One of the things that I see in my clinic all the time is treatment-resistant depression. This is a type of depression that doesn't respond to antidepressants or the typical therapies that we use to treat depression. 9 out of 10 times, these patients have been exposed to mycotoxins and have a condition called Chronic Inflammatory Response Syndrome. This is something I've personally struggled with myself, and one of the first symptoms that showed up for me was a black hole depression. And I remember telling my husband, I'm like, why am I so depressed? Everything in my life was going great. My children were thriving. My business was thriving. And I had no reason to have this black hole depression. This week I actually had a patient in that I've been treating for a long time that has not responded to any of the typical therapies for her depression, such as Psych meds by her psychiatrist, Psychedelics, or anything. And I ran a microbial organic acid test on her, which demonstrated that she had mycotoxins in her urine. After further questioning, I figured out that her depression started when she moved into a moldy home. So if you've got treatment-resistant depression, you need to be looking into something called Chronic Inflammatory Response Syndrome. One way that you can screen for this is you can go to survivingmold.com and take something called a VCS test. It's $15. If you fail it, you've got neuroinflammation, and this could be the cause of, or mycotoxins could be the cause of your treatment-resistant depression.